it remains mild or moderate. But in some cases, especially in the old persons having conditions like diabetes, hypertension, cancer, so they develop more serious things and they go into the acute respiratory distress syndrome. And if you will like to see the virus as a whole and in a cut section, you will see the spikes, you will see the different types of the proteins, M proteins and E proteins, and then you can see a capsule around, and in there is a single RNA strand. So how this is spreading? So this is spreading from the saliva or discharge from the nose or mouth, and it is due to exhaling, talking, coughing, sneezing, and when the droplets are falling on the certain objects, so it can spread from those objects also, which are known as fomites. So due to this Corona-19 disease, there is fear in the patients and clients coming to forensic nurses. So they don't want to come because they are afraid that they will get the disease. And similarly, the forensic nurses are a little bit also afraid because so many health workers have died in the treatment process and while providing services. And everybody is afraid due to increasing number of infected cases, and then the different waves of the disease are coming. Morbidity and mortality is increasing, and by now more than 1 million deaths have already occurred. And due to this, the practice of forensic nursing is also changing in this pandemic. So challenges to the forensic nurses. So these challenges are going to depend upon the zones in which they are practicing, or the zones in which the cases are falling, where they may have to go to get the samples to do the medical legal examination. So again, this is going to vary from country to country, but mainly there are red zone, orange zone, and green zone. Red zone where the rate of duplication of the cases is very quick, and then in the green zone there is no case at all, and the orange zone lies in between. And then there is a containment zone, so where there are number of cases, and that is the epicenter, and 3-kilometer radius of the epicenter, that is the containment zone, and usually it is divided into sectors where each sector is having 50 houses. But in some difficult areas, for example, hilly areas or rural areas where the houses are very far apart, so that there in the sector there are 30 houses are coming. And then there is a buffer zone, so that is 5-kilometer additional radius in urban area and 7-kilometer additional radius in the rural area. So if we have to see the forensic nursing practice, they are doing the practice of forensic nursing in many areas. But today, keeping in view the short time, so we will discuss the main areas. So that is where they are working. They are working at the crime scene examinations. They are working in the postmortem examination areas. They are working as sexual assault nurse examiners. They are working for the child abuse, for the elder abuse, for intimate partner violence, for trauma cases, for workplace issues, and for the institutions. In some institutions, they are working. So we will discuss that what are the different challenges to one by one. So in the, if it is to be seen to the crime scene investigation. So what I am going to talk about today, that is of course for the forensic nurses, but most of the things they are applicable in general to the forensic scientists too. So what are the challenges? So the challenges are that there is a risk of getting infection. And if some person who is at the crime scene, he is having this virus, he can spread this infection also. And this can happen while they are interviewing the person, while they are collecting the evidence, they can get it from the other team members. And when they're collecting the samples and sending it, and if they spread the infection, then the samples will become infected. They will become fomites. And if they send the same thing to the labs, the persons who are sitting in the lab securely, the virus will go there and they can catch hold of this infection. So this is very important, that how they deal at the crime scene. So as far as the postmortem work is concerned, the forensic nurses, they have to receive the positive dead bodies. So while they are receiving, so again, they have to handle it carefully. So if they don't do it, then again, the spread of the infection will be there. And if they have the dead bodies, that how to diagnose the COVID-19 dead bodies. Sometimes the dead bodies come when they have already been diagnosed. Sometimes the dead bodies may come when still they don't know whether it is corona positive or it is negative. And then important thing is there is a team, including the forensic nurses, forensic pathologist, sometimes the forensic radiologist, and many other persons. Sometimes they get involved. Forensic odontologists, they get involved. Forensic anthropologists, they get involved. So depending upon the situation, so they have to protect the whole of the team. They have to advise them. They have to take the precautionary measures. And again, they have to collect samples at the time of postmortem examination, and they should be very careful that these samples don't get infected. And when they have completed the autopsy, completed the postmortem examination, then they have to hand over the dead body to the relatives. Again, it is in the COVID-19 scenario, it is very important that how they do this, and how to take the psychosocial need of the members of the team involved in the postmortem examination, because this is a critical situation when everybody is afraid. So people need psychological support too. They need social support too, because once the doctors are doing all this, sometimes you must have heard that they are not allowed to enter the homes. They cannot go near their families. So if they are living on the rent, then they have faced another set of problems. And you know, a recent case where a person was just sleeping in, a doctor was just sleeping in his car because he was not allowed to enter where he was staying. So these things happen. So in such situations, psychological support is needed. So that has to be provided. And another important area is for the nurse is the sexual assault nurse examiner. In USA, under the supervision of the doctor, they are doing the examination and collection of samples of the rape victims or all other sexual assaults. And due to the fear of this disease, many of the victims are afraid to seek the advice of the nurses. And number of the persons coming to the forensic nurses that has decreased because of this fear. So examination where it is being done. So now sometimes the patient cannot come to the hospital because he is having at the examination place because of this disease, the isolations and quarantines purposes. So sometimes they can't leave. And when they reach there, or when the patient comes to them, and they are in the PP kits. So when there is a PP kit, the victim cannot see the face of the forensic nurse or the doctor. So it is very difficult to get the report in such situation. And when the victim is not able to speak, not able to see the person who is treating him or talking to him, talking to her or him. So in this situation becomes very much dehumanizing. And sometimes the patient may have to examine in the ward, and when it is a general ward, you see there is a lack of privacy. you have to do in front of the others, or make some stopgap arrangements like putting a sheet or a screen. So in this such situation, the victim becomes very much uncomfortable, and sometimes even the nurses, they are not comfortable in examining their patients in such scenarios. And moreover, whenever such things happen, usually the mother, father, sister, or friends, they are accompanying the patient. But in the scenario of Corona-19, they cannot come along with the patient, and victim is missing a very important support in such situations. When there is no relative, they are usually the members of the advocacy groups who come along with. But in this situation, they cannot come along with. Now people are staying more at home due to the Corona-19 situation, and due to which the domestic violence is increasing. And it may be intimate partner violence, it may be elder abuse, it may be child abuse, it may be a sexual abuse, and cases of all these types of violence that is increasing in these times. I was just showing you a photograph of a case where the husband was kicking the wife, and you can see the bruises on the inner side of the thighs. So he was just beating him like anything. So this is in such cases of intimate partner violence, they are on the increase during this pandemic. So what is the reason for increase of this violence? Because the people are socially isolated due to these lockdowns, and even after, the people are staying more at home, avoiding unnecessary travel, and they are spending more time in the family. When the more time is spent, usually the things start worsening. Sometimes initially it was very good, but with more and more time, the things are not good. And then there is a fear of getting the disease, that I will get the disease, or some family member will get the disease, and there is always a lingering fear in the minds of the people. Some people have lost their jobs, some people income has decreased, some have totally no money, some have less money, because it has been seen in most of that some cut has been there on the wages. Somewhere it is 30%, somewhere it is 40%, somewhere it is 50%. And all these things, social isolation, fear of getting disease, less income, that is increasing the mental stress. And due to this increased mental stress, all this is happening. At workplaces too, the persons have the risk of getting infection when they are traveling for their jobs, especially in the public transport, or if they're sharing their vehicle, again, then there are chances of getting infection from each other. And when they reach the job, so there can be cross infection amongst the workers. Or if someone is a service provider, he goes to the homes, families, and even if they are giving service sitting in their office, they are coming in contact with people. So when they are coming in contact with different people without knowing the status, whether they are corona positive or corona negative, of course, some measures are taken, but these measures cannot absolutely prevent. They can decrease the rate of infection, but they cannot totally prevent this thing. And moreover, the people are not educated that much that they will follow always. We have seen that they say the mask should be there, but where the mask is most of the time it is on the chin, or it is covering the mouth, but nose is open. Sometimes they are not wearing the mask, sometimes they see the policeman and then they wear the mask. So there are so many problems, and forensic nurses have to interview the responders and survivors of the crisis, and that is very important thing. The patient is not wearing the mask properly, if the forensic nurses are not wearing the mask properly, So all this is affecting the work culture at the workplaces, and the people are, you see, not that much comfortable. Then there are institutions like jails and other government institutions where the people who needs protection, they are kept. So culprits are in the jails. Sometimes they are in the police stations. Refugees are kept, also kept in certain centers. So at these places, these have been designed for the normal times. And here now the social isolation is needed, and that cannot be maintained, and there is overcrowding in these places. And so due to the overcrowding, because of the less space, there is increased risk of infection, and especially the old people, they are more vulnerable to the disease in such scenarios. Then there are palliative care scenarios. So there may be old clients, old victims, and at the nursing homes where they are kept. So again, there are more chances of the infection. So abuse, so we have to prevent the abuse, and how to report safely, because there are issues because of these lockdown situations. The persons are not able to report it safely because the abuser and the victim, they are lying at the same place. And as far as the forensic nursing education is concerned, it goes with all other types of the educational centers too, that due to the lockdowns, still the schools are closed. And in many parts of the world, somewhere these have been opened, but then the infection has spread further, and they are again thinking of closing the institutions. And then if there is a, and when there are lockdowns, the students leave the institutions, and that how they, then is a problem that how to manage their lectures, how to manage their practical classes, how to manage their seminars, tutorials, assignments. And after even if it is all delivered, then how to manage the assessment, it is a big issue. So safe delivery of lectures is a big issue. Safe lab work is a big issue. And it is lab work, of course, is going to remain for a sufficient time to come till we get the vaccine. And we have to keep safe the students, we have to keep safe the faculty and other workers in the institution. But simultaneously, we have to see that the educational services are not jeopardized. Somehow this should continue, otherwise nation goes back. And now that how we have to face all these challenges. So we have talked about what are the different challenges, and now we will talk about that how we need to face all these challenges. So first we will talk about the crime scene examination, that the crime scene, how the situation should be tackled. Forensic nurses are now in the advanced countries, they are becoming part of the team of the crime scene examination because they know about the human body, they know about the anatomy and biology. They can help the help at the crime scene in a better way. They can tell, yes, it can be a natural death, or it seems that it is a natural death due to some disease process. And if there is a need to collect the biological sample, they know in a better way that how that is to be correct. So whenever in the era of COVID-19, crime scene should be taken as a red zone or a hot zone. And so persons should wear the PP kit. So this will protect the examiner as well as it will minimize the contamination of the evidence. And simultaneously, there are some chemicals which can be absorbed uh, from the skin. Transdermal absorption is there, so it will also protect them from this when they are doing the crime scene investigation. So as the forensic nurses deal with the biological sample, dead body is positive, it may be positive, may be undiagnosed, maybe healthy even, but all workers, they should work in such a way that infection is avoided and the samples, they do not become infected. And the police personnel in such situation, they are too wearing the PPE kits. So the wearing of the PPE kits and how to dispose of these kits, again, that is very important to avoid the infections. So for this, the virtual crime scene examination, that is the another possibility by the 360 degrees imaging cameras or the 3D laser scanning. And recently, some scientists with the help of the NASA, they have uh, joined hands for the crime scene investigation by uh, space exploration technologies. And they have investigated blood, they have investigated seminal stains, they have investigated gunpowder residues and primer residues using portable X-ray fluorescein systems for analyzing non-destructive chemical composition as is done by the on the different planets. So for this, you just need the laptop and 3D technology, and that will help in the virtual crime scene investigation. Of course, this will have some limits, but wherever this can be used, it should be used. And it again is going to depend upon the funds with the crime scene investigation team. And usually in India, there are not much funds, but gradually the things will improve as it is help improving in the other parts of the world. How to handle the dead autopsies. So there are general guidelines for working handling dead bodies and safety and precaution while handling dead bodies. So how the autopsy should be done, how the specimen should be collected, how the disinfection and sterilization of mortuary should be done, how the embalming should be done, and how safely and in a dignified way that dead body should be go through its final place of rest. So these are the different issues which we'll discuss one by one. General guidelines for workers packing the dead bodies. So before the dead body is packed, so the nasopharyngeal swab should be taken if the case is not diagnosed already, and should be immediately sent to the lab. And if there is a delay in sending these samples, it can be stored at 2 to 8 degrees centigrade, but this can be done only for 2 to 3 days. And if more time is required than this, then it should be stored at minus 70 degrees centigrade if the time period is more than 3 days. So then the body should be put in the body bags. So these body bags should be transparent. It will be better if these are transparent because everybody can see the body from the outside, and identification of the dead bodies and mixing of the dead bodies will not be a problem. Because this has happened, the body has been taken for cremation and then it is a dead body of somebody else. So if the transparent body bags are used, then these problems will not be there. So if there are any injuries and any holes on the body, that should be disinfected with 1% hypochlorite solution, and then these should be sealed with impermeable material. Similarly, all the orifices of the body, that should be plugged. And then when everything has been done, the exterior of the body bag, that should be decontaminated with 1% hypochlorite. So then another problem is how to diagnose the disease in the dead bodies. So for this, only RT-PCR is the recommended method. In some cases, viral gene sequences that can be done, but again, that is costly process. So it is further recommended that not to use IgG, IgM measurements to diagnose the COVID-19 in case of the dead bodies. Then there are general guidelines for workers transporting the dead bodies from the place of death to the place of autopsy. So sometimes it is needed because this is Corona-19 is a natural disease. Persons have died. So that normally the autopsies are not required, but sometimes the dead bodies are brought in the emergency where the treating doctor doesn't know anything about the case. So sometimes these cases are referred as medical legal, and then it has to be shifted from the ward. Sometimes even when there is an injury case or something else. So whenever such body is to be sent, the status of corona positive should be clearly mentioned on the body bags. And the trolley on which this body is going to be taken, that should be first of all distributed with 1% hypochlorite solution, and the worker of the ward should hand over this dead body, not that another person from outside should go inside and get the dead body. The person who is already working in the ward, he should bring out the dead body and should hand over in an area outside that ward. And another person is going to receive the dead body. Preferably, it should be the same person of the mortuary who is going to take part in the postmortem examination. In this way, we will reduce the number of people coming in contact with that dead body to prevent the spread of the infection. So all those persons who are handling the dead body, they should be in the PP kits, and the complete PP kit should be used, and that again, the trolley should be disinfected. Then when it is brought to the mortuary, so sometimes these have to be kept, maybe it is brought in the evening, the postmortem examination is to be done next day, so then the bodies has to be kept in the cold chambers. So some cold chambers, if there are many cold chambers, so some may be dedicated for the COVID-19 dead bodies. And if there is only one cold chamber and all the dead bodies have to be kept there, these corona positive dead body should be kept in the lower chamber so that there is not a spillage of the contents. Because if it is kept at the top, the spillage will come to the bodies which are lying down wise. So it should not be there. So before then after the postmortem examination, the body should be, when it is to be kept in the bag, that should be properly zipped, and the zip should be tied, and the body bag should be disinfected, and the body bag should be put in another opaque bag sheet. So when it is decided that autopsy is to be done, so now what precautions we should take? We should not do invasive procedures, such invasive procedure where there are much chances of the spread of the infection. If the dissection of bones is to be done, or some aerosols are to be produced, so such procedure should be avoided. WHO, the World Health Organization, has said that there should be a verbal autopsy, but it will again depend upon the laws of the country whether they allow such things or not. But the verbal autopsy in scenarios of COVID-19, they have been said to it can be done, and there are very set procedures for this, and it can give a very good results in the verbal autopsy. So the age groups are defined, male, female are defined, then what questions are needed to be asked from them, they are defined. So it can be done in the natural disease as well as it can be done on the medical legal cases. So wherever the verbal autopsy is allowed, so that can be done, and that will help in the situations of the Corona-19 scenarios. And if the autopsy is to be done, we should strictly avoid any invasive surgical procedures, and wherever there is a splashing of the blood and tissues, so such procedures should always be avoided, because if such splashes will be there, the handlers of the dead bodies and the doctors who are doing the postmortem examination and the forensic nurses who are helping in this postmortem examination, so they can get this infection. So examination of the dead body should be carried out first and seen that what are after identification that what are the injuries, what apparent cause looks like, and then the examination of the clothing should always be done. So these two things are very important because sometimes they give a very much valuable evidence, and the photography can be done of the cases to show these and everything. And if the digital X-ray of the full body can be taken, that should be done. Or if the CT scan can be done, that should be done. And always a logbook should be maintained in the mortuary, so that all those persons who are entering the mortuary, there should be entry, so that if there is an infection, people know that who are the people who have come here, and they can be traced. And another good scenario is virtual autopsy, and virtual autopsy can be utilized in the forensic postmortem examination cases. And this virtual autopsy should be done in such scenarios. And CT scan can do this virtual autopsy by CT scan, and this has got its own advantages and disadvantages. That is a separate issue, but in the age of Corona-19, so this is a very good alternative in many scenarios. Then the collection of the samples. Till some labs are designated as Corona-19 labs, till that time, so they have said that if the autopsy has to be done, the sample should not be preserved. But for if the body is unidentified, then in those situations, the fingerprints should be taken, the photographs should be taken, and the bunch of scalp hair should be kept. So in this situation, this should be done. Embalming after the postmortem examination or otherwise preferably should not be done. But if it cannot be avoided, then it should be done with the minimal invasive techniques. It should be done. After the postmortem examination has been done, and then the packing of the dead bodies has to be done again. So this is a packed in leak-proof, transparent double body bags. So usually one body bag is used, but in such situation, the double body bags are used because the autopsy has been done. The body then, if it is in the transparent body bags, then the body should be tightly wrapped in opaque plastic sheet so that everybody doesn't get disturbed, so which later on can be opened. And these body bags should not be opened for the religious ritual, and the body handlers, they should wear the complete kit, everything they should have, coveralls, masks, gloves, shoe covers, head covers, and everything. So whatever is a part of that kit, that should be there, and this body again needs to be labeled as the corona positive dead body, so that by chance it does not mix with any other body. If the test report is awaited, whether it is corona positive or not, usually the bodies are not given to the relatives at that time. And if it has to be given, then it should be given with all the precautions, like that it is a positive dead body. And that body should be handed over to the district administration, and they will hand over it to the relatives. More relatives should not be present, only minimum number of relatives that are allowed from the time to time, those numbers should be present, and body should be identified by the relatives through the plastic bags only, without opening the bag. That is why it is said that it should be transparent body bag. All of the transparent body bags can be there, just transparency can be at the level of the face, and that will help the as law enforcement agencies, so that the right dead body is given to the right family. So if these bodies are to be transported, how this can be safely transported? So The transportation can be through the road or by air. And the cold vans should be there where the temperature is 4 to 8 degrees centigrade, and for 72 hours it is safe to transport through the road. Preferably it should not be transported by air, but if the circumstances are unavoidable, then in this situation the same embalming has to be done before these are being transported by air. Then question comes of the final disposal of the dead body. It can be done by cremation, it can be done by the burial, but it should be done in the presence of the law enforcing agencies, where not more than allowed relatives. Previously, the number was 5, and now this has been increased. So whatever the permission of the state governments or the central governments is there, so we should go according to that. But large gathering should always be avoided. Why? Because you never know who is corona positive or who is not, and there are chances that the caregivers of the person who are at the home, they may also be positive. They may be asymptomatic at that stage, but that may be spreading the virus, or they may be shedding the virus. Then the sexual assault nurse examiners. So this is the biggest role of the forensic nurses. The sexual assault nurse examiners, how they will deal with this thing. So there should be, again, biggest thing is there should not be contamination of samples, and the procedures need to be changed in the scenarios, and we have to take care that these samples and these packages do not get infected themselves, and the number of people who can be allowed at the time of examination, that should be minimum to avoid the contamination and spread of the infection. So to overcome the situation when the peoples are quarantined and isolated and they don't want to come for examination, so then the do-it-yourself rape kits have been there. So through the video conferencing, the forensic nurses are guiding, and the patient herself is taking the samples, and but it should be very clear that do-yourself kits are not better than when it is done by the forensic nurses. So sometimes this can give a false sense of security for the safety of the evidence. So sometimes questions may arise in this. So when a patient or a victim is a hot zone, then what should be done? So this has been taken from one paper. These few slides have been making by taking the material from that, and that is the reference is given at the end of this slide. And so establish contact with the hot zone on the ground, treating staff member, whosoever is doing it. So first establish the contact, establish the patient medical and the urgency of forensic medical examination, whether it's required or not. So all information that can be taken should be taken on the phone. Request assistance with the nearby cold zone. So there is a hot zone, and an area should be selected outside that hot zone, so that the red zone, so that the things are easy there. So safety is the most important thing. So usually the two practitioners are examining face-to-face contact with the victim in the hot zone. That is minimized by using the telehealth, and personal belongings should not be brought to the hot zone. If they have to be brought, that should be in a zip bag, and the scratch should be doffed. And that's the step is the preparation of forensic samples in the cold zone. So not it in the hot zone, but in the cold zone. And so all the labels, they are selected there. So whatever examination is to be done, everything is prepared there. Sampling and labeling. Sampling is done at the crime scene, but the labeling is done here only. And usually these are different receptacles, different boxes. Small boxes put in a bigger box, and that bigger box is put in another bigger box. So it is done like this to avoid the infection, so that we can drop the outer box at the hot zone. So the outer packing, the outer zone, the outer packing is left at the hot zone, and then there is another one which is taken to the cold zone. So everything when is being taken to the hot zone, that should be clean, that should not be infected, it should be taken care of. And you should see that everybody is properly wearing the PPE kit. And even in these time, the consent of the patient is very important, and that should always be procured. And you can do the first the general body examination, and then the one forensic nurse can conduct the anogenital examination. So when it is done, additional pair of gloves over the kit is used, so that there is no contamination for the DNA samples. So it is very important. And one person is taking the samples, and the another person is putting these samples in the boxes wherever these has to be kept, so that there is minimum contamination on the boxes. So from the hot at the hot zone, when the person's everything has been done, the outer box there that should be left there, and you should see that these PP kits are still on, and the box is sealed with the tamper-proof seals to maintain the evidentiary standards, labeled with COVID-19 risk stickers also, and inserted into the clear, clean plastic bag, followed by the hand hygiene. And handing over the samples to the police, that should be can be either in the cold zone or in some areas which is outside the hospital, maybe like the parking zones. So because there's a need to reduce the rate of infection, reduce the chances of infection, and maintain the complete chain of custody. So these two things are very important in this area. You have to maintain the complete chain of custody. Simultaneously, you have to take care that the infection does not spread. And some collections of the samples that can be deferred if possible. If photography is required, camera should also be properly cleaned and put in a plastic bag. And if the injury documentation is to be done on the paper, performer required, this should again be care should be taken that this does not become infection. For this, the hand hygiene and repeatedly hand hygiene should be done. So now we are coming to the other types of abuse. That is the forensic nurses. Often they go for the examination of the child abuse cases and detecting the child abuse cases. Schools have been closed, and this has added the stress to the caregivers, because first they were taking care of the children for less time. Now they have to take care 24 hours. And so this lockdown has increased violence because of social exclusion and maltreatment. And there is some person, they attach a stigma because this is a contagious disease, and children are also vulnerable to this stigma, and they may face violence at the hands of the others. And simultaneously, the domestic violence that has increased, and because of the unemployment and less of income. And this child abuse has also increased during this pandemic. So during this situation, we should emotionally support the children. We should support children who are alone in the hospital sorry, due to the disease process. And we also need to support the children whose parents have died. So if we will not take care, then the situation will be very worse for the children. But the elders in the families, they also face abuse because of the social distance policy and the limited interpersonal contact. The visit of the children to their parents, that has decreased, and they are facing social and economic hardships because of, and they are simultaneously have the high risk of disease, and they have the limited resources at this age, and there is a competitive care in the family. Because they say the children need more care, the adults need more care, so they are given first preference. So this puts stress on the mind of the caregivers as well as on the minds of the elders. So due to all these reasons, the elder abuse has increased, and they are facing physical abuse, they are facing sexual abuse. Of course, the psychological abuse is there, and there is a financial exploitation too. And due to less of money, they find difficult to access the healthcare facilities due to the dwindling financial resources. And it is very important that such abuses are detected and reported, because the person who will be doing the abuse, that will be in the family too. So in such situation, reporting of the abuse will be very difficult, and their human rights of the elders are going to be violated. And the most difficult thing is because the elders' health has been deprioritized. When the ventilators are required, 10 ventilators, and there are 20 people, so they whom to put the ventilator. So they said, okay, these are the old person, they are should not be given a priority, and the young person should be put on the ventilator. So they are left to die as such. So this thing is very much painful in many areas. Intimate partner violence is also increasing because the victims of interpersonal violence, they are trapped with their abusers. One in the 4 women and one in the 10 men face this interpersonal violence. But in India, the females are more affected due to the patriarchal mindset of the society, and victims are not able to report the cases. And in this, because sometimes the victims also have to take care of the children, and is also earning family for the family, and the abuser is also doing the same thing. So both there is a situation where there is a lot of stress, and they are not able to report safely. And um, so the forensic nurses, they are trained to report this gender-based violence and support the gender-based violence survivors. So this is increasing. So this needs to be taken care of. So in addition to this, coming to the other aspects, the impotence is increasing amongst men. And this impotence is causing frustration, agitation in the minds of the men. And that is also the reason of the interpersonal violence. And due to this, the physical trauma has increased 1.8 times in this epidemic in one of the studies. And the high risk abuse has increased 2 times. And forensic nurses, they are trained to identify, they are trained to report such cases, and simultaneously they can provide psychological support to the survivors of these cases of violence, and they can report it to the appropriate authorities. Trauma cases, as far as concerned, they have decreased due to lockdown because unnecessary travel has been diminished, but now the things are coming back to the normal. And this in the lockdown times, the scuffles were there, they were not following the rules, police beating them, or they're running and then falling, and the domestic violence is increasing, and all the types of the abuse is increasing. So this, the second part is not decreased, but the first part definitely decreased during that time, road traffic accidents. So when treating such cases, peri-operative period is very critical. Before operation, during the operation, and just after the operation, it is a very critical stage when the infection will spread, and many nurses and doctors have become infected in this process. And sometimes the trauma patients, they are not corona positive, but they are lying in a hospital where they are corona patients too. So there can be collateral damage to this trauma patient, that they can get infected. And there is a need to follow the protocols to prevent infection. So everywhere SOPs should be developed, and these SOPs should be followed by everybody, including surgeons, including nurses, including forensic nurses. And forensic nurses have to collect the biological samples in this during the medical legal examination of the patients, and they should to take care of it. At workplaces, as the disinfection can occur at workplaces, and person can get the infection at the workplace. And in one of the studies in Spain, 22% of the workers which got the infection, they were the healthcare professionals. And out of this, the 76% cases were of the women employees. And this is a occupational hazard, or you can say it is an occupational accident or occupational disease. And then the claims may be made by the employees, and forensic nurses too may be involved. They may make the claim, and they can help. They may help in settling these claims. In the institutions, early detection of the positive cases, that is very important, because if it is early detected, it will not spread to the other person. Otherwise, this will spread to the other person. So for this, the use of mask should be their policy of using of the mask. Of course, maintain the social distance, frequent hand wash and sanitation of the hands, and not touching the face. So these are the 4 basic things which should be adhered to. And wherever possible, the institution should allow the workers to work from home, so that the less number of persons are coming in the social distancing amongst the workers. That becomes easy in such a situation if the persons are working from the home. So in the detection centers, now they cannot be allowed to go. So even if there is an infection or something, so the policies needs to be developed. The forensic nurses are trained for such things. But if the nurses are not trained, that can cause a lot of damage in such situations. And as far as the education part is concerned, the different problems of the delivery of the education can be set by the online video conferencing for the lectures, and these lectures can be interactive, and there can be question answer sessions. So interactive, they can raise their hands. Question answer session, it can be, some periods can be decided that now the question can be asked. And sometimes in an asynchronous way, the pre-recorded lectures and material can be sent by emails to the students. It is better that a combination of these 2 methods is used. The serious students, they will always study, they will always want to go ahead, and assessment can be done by the Google form or Viva Voce during the video conferencing, or small batches can be made for the tutorials too, in the split room facility. And so then, so the forensic nurses are there to provide the help. So all the victim, they as far as the practical situation, if they are coming, the practical scenarios can be taught to the students, and telehealth is a good solution. And the most important thing is that in these scenarios, all the workers, whether it is a practice, whether it is an education, all of them should be protected. Then there are advocacy groups which are coming with the patients, so they can also use the telehealth method to contact the victim. Similarly, the prosecutors may do this thing, and similarly, the advocacy groups can can do this. And as the things are changing, the forensic nurses too have to change in the era of this pandemic. And whether it is a practice, whether it is a education process of the forensic nurses, we need to adopt, and the forensic nurses too need to adopt to the changing scenario. So there are online educational programs, and such programs do not pose any issues. And as far as the practice is concerned, alternate sites other than the emergency, because in emergency there will be lot of rush, and there, if a patient is a corona positive, then if we will do the everything in the emergency, then spread of infection will be more. So we have to choose the alternate sites for such victims. And whenever such victims are to be examined, the PP kits have been advised. And there is a need to assure the patients and victim that forensic nurses services are safe and forensic nursing services are open. So these things should be there, and forensic nurses have to show the flexibility when dealing with the situations, and many times they have to innovate so that the proper things can be done. And routinely, this is a victim examination center where these three, I had an interaction with these three forensic nurses who are there, who had examined a case at that time. So sometimes the forensic nurses may not have this type of the facilities, and alternate sites they have to go. So they need to be flexible. They may not get all the instruments like colposcope is set here for finding the genital injury, but it may not be there. So they have to be innovative in those circumstances. And they should develop the plans that if the load work increases, how they are going to do this. And whenever they are not sure, they should take the help from the local health authorities. So whatever the guidelines for the community. So what are the guidelines for the hospital? So they must adhere to that. So I will like to conclude that it is better that victims and clients seeking forensic nursing help should continue to seek the help so that the things can be properly managed. Um, and they should be made aware that this service is not closed, but this service is open, so they can come here, and there are very less chances that they will get infection. So they will not get infection. Everything is being taken care of. So, and this should be, sorry. Forensic nurses should practice in such a way that it is safe for their clients, it is safe for the other health workers, it is safe for themselves, and they should adopt all the safety measures and protocols of the local health authorities. And the forensic nursing education that should go on through relaxation is not a problem, assessment is not a problem, but of course the psychomotor skills development, that is an issue, and that can be taken care of when this period slightly softens. So as the knowledge about COVID-19 disease is changing with the more research, and we will come to know about more and more about this disease. So whatever new things are coming, we need to change our practice according to that. So these are the references. And thank you very much. You can ask me questions right now, or you can contact me on my email, or you can visit my website, and you can visit the channel too. And thank you very much for listening patient. Thank you very much.
I must say, sir, it's a very beneficial and useful thing for all of us. Now we go on for the question answer round.
Please go ahead.
So, sir, first question was how forensic nursing can be helpful in crime scene investigation.
Because forensic nurses are not part of the team in India, but forensic nurses are part of the investigation team in many countries, like in some states in US, in Switzerland, in Australia. But the number of forensic nurses are less. That is why in India so far the forensic nurses are not employed, because if forensic nurses will be present in the team, they know better anatomy than anybody else in the investigation team. They know the physiology, they know the pathology of the disease in a better way. And say a person has died due to tuberculosis, and when at the last moment the person has coughed out blood, hemoptysis is there. So in this situation, there will be blood at the crime scene. So the persons who doesn't know anything about the disease, they will say that yes, no, it is not a natural death. It is something wrong is there. But if a forensic nurse is going to be there and there is a history of this tuberculosis from the documents around there, so can I say, yes, this can happen in hemopsy, blood can come. So there is no need to panic in these situations. So there are so many circumstances where this can help. And moreover, when the biological samples are to be collected, forensic teams are not always there. Usually this is being done by the police officials who are slightly trained in this. Then forensic nurses who are very much trained to handle the biological samples, they will be very useful now, especially in this COVID era. So they are going to be very useful in these situations.
Okay, thank you, sir. The second question is, can a student who has done master in forensic science can pursue a career in forensics nursing?
For this, there is basically a nursing degree is required to become a forensic nurse.
Okay. And the third question is, what is the significance of forensic nursing?
Significance of forensic nursing is according to the scenarios, because many in the examination of the rape victims, the successful prosecution rate was very less, agitated by this even in the US. Now I'm not talking about India. It is even less prosecution rate. But agitated by this, Virginia Lynch started this specialty of forensic nursing. And when this has been started, the forensic nurses doing the examination of the rape victim, of course, it is under the guidance of forensic pathologist. But since then, the rate of successful prosecution has increased, say something like from 50% to 86%. It is only the taking of the samples. If the samples are not taken properly, and victims also get easy referred with the forensic nurses, because their only job is to do this, because the doctors, they have to do many other things too, and they are more bothered about saving the lives of the patient. So if the two cases come to save the life of the patient and examination of a victim, where do you think the doctor will go? The doctor will go first for saving the life of the patient, and then will be the priority. If the forensic nurses are there in the institution, so their only job is to take the samples from the victim. In that case, the successful prosecution rate, because of the better evidence collection, the rate of successful prosecution has gone up. So it is similar with the other aspects. Now in the postmortem examination, the technicians are not there. Only these are many times the class force, they are helping the doctors. So without the help of the technicians, without how the things can go, the forensic nursing can be as useful as the forensic postmortem technicians. And they always get a rapport better with the patient, because it has been taught to them. They know the communication part of it. So it is very useful. So I have given these two scenarios of rape victim examination and the postmortem examination to you. So these are useful. So they are useful in 10 to 15 different fields like this, when it is costing less to the government than employing a doctor. So this is a financial aspect to of this. But again, it will depend upon the law of each country, that how the things are to be done.
Okay.
Thank you very much.
Another question by Shovanlal Maiti. Is there any function of nurses in forensic nursing? If it is, what are those?
Yes, we have talked about some aspects, that crime scene investigation in the postmortem examination team, in the crime scene investigation team. But in addition to this, there are many other roles. So for example, the human rights violations in the institutions, correctional institutions, like in the jails. So if something is being done, If somebody other goes, they don't have the time. So the forensic nurses can spend them and can find out that they're having some abuses, and they can report these abuses, and these abuses will be less. Then, say, for example, in the insurance companies, forensic nurses can help in those insurance companies because they can't employ the doctors. It becomes very costly process many times, and they can save the money of the insurance companies. So they can help the advocates. The advocates are non-medical personnel. They are not knowing much about the human body. So something questioning is to be framed, that what type of the questions need to be asked. So the forensic nurses can do the research on that particular case and can suggest very good questions, so they can be part of the legal team. So there are so many issues. They can work in the schools too, where the child abuse cases, the most of the time, it is easy to diagnose the child abuse cases by seeing their behavior of the kids. So there are so many situations. It is a numberless situations where the forensic nurses can work, in addition to the 8-10 situations which I've told you, like child abuse, elder abuse, intimate partner violence, and so much and so on.
Okay. So thank you so much, Dr. Sir, for showing your word with us. We are blessed to have such a brilliant experience and senior speaker to be a part of our webinar series. I also thank you all participants for your support. I would also like to share some the information of next webinar, which is going to held on 24th of October 2020. For more details, you can check our social media account. Thank you, everyone. I hope you all have enjoyed the session. Wish you all a great day ahead. Thank you so much.
Thank you. Namaskar.